My name is James Pappas, and I work in the Department of Pathology, Loma University School of Medicine. Well, I was born in San Francisco, California. I like science, and I especially liked the science of the human body, and was always fascinated by physiology and pathophysiology and stuff like that, and still am. Never have lost that. Pathology is two different things. It really is two big areas. One is what we call surgical pathology, and that's what you usually see on TV. You know, when you watch some of these things where they're talking to pathologists on like CSI and stuff like that. That's autopsies and looking under the microscope at samples and so on and so forth. There's another big part of it though that's called clinical pathology, which is essentially laboratory, and that's what I do. I'm a clinical pathologist. I don't do any anatomic pathology or surgical pathology. I haven't for a long, long time. And I run a lab. I'm a medical director of, or at least part of my job is medical director of the laboratory at Loma University Medical Center. What we do makes a big difference in the hospital. That's, you know, probably about 70% plus or minus of the decisions that physicians make day in and day out are based on the information we give them from the laboratory. So it's a big, big deal in terms of how physicians take care of their patients. A favorite moment was probably some years ago when I was in internal medicine, way before I was doing what I'm doing now. I was an internal medicine resident here, it'd be the mid-1980s. And there was a patient that was admitted to our unit from surgery. They were transferred from surgery, very, very sick, and had lost part of his bowel and was having all sorts of problems with fluid balance. And he told me he wanted to die. I remember he told me he actually just wanted to die. And I remember sort of grabbing his hand and saying, the guy was in his 40s, he was in his early 40s, you're way too young to die. You got to get over this. And we worked with him. We had a pretty good team. We worked with him and got things sort of straightened out, and the surgeons were able to go back in and correct some stuff. And then he went home, and then probably a year and a half later, I was just roaming the floors out there. And this might have been when I was in pathology. I think I'd gone into pathology by this time. And I saw this guy, and he saw me, and there was instantaneous recognition. And he smiled, and I smiled, and we shook hands. And there was just this unspoken thing about how that had been sort of a moment, you know, back then. I like to play drums. That's my hobby. If it wasn't for the fact that you can't make a living playing drums without playing on Friday night and Saturday, I probably would have been a professional drummer. Healthcare is changing a lot. It's not going to be the same in 10 years as it is right now. It's going to be a very different practice. Make sure that it's something that you feel in your soul that you really want to do for the rest of your life, that it's something you think you'll love, and go into it for the right reasons, and you'll be happy doing it. If I had to pick a motto for my life, it would be never quit. Because I have found in this job that nothing ever happens easy. It never happens the first time. If you think you're right about something and you've got the support of people that think you're going in the right direction, you just have to keep coming at things and not get disappointed, because things hardly ever happen right the first or the second or the third time. You just have to keep going and going and going, and over time things get better.